together. Radio MANUU 91, where it's always better. Where it's always better. Yo. सुबह का सूरज या शाम का रंग, we bring you joy हर जुबान का धन. Community की बात हम हैं आपके साथ, let's spread the love, चलो मिल के साथ. Tune in, turn up, दिल से बात करो. Radio MANUU ताकि गुरु FM के साथ चलो. Every voice counts, हर लम्हा यहाँ, चलो बात करके देखते हैं. Let's all shine on. Yo. Let's all go. सेहत की बात or dreams to share. Radio MANUU 92 FM, we're always there. From unity to joy, we bring the light. Every word, every tune makes everything right. Listen up, it's time to unite. Radio MANUU 92 FM, shining bright. Dill se suno, we love and care. Chalo baat karke dekhte hain, let's take it there. So come along for the ride. Radio MANUU 92 FM, we're by your side. चलो बात करके देखते हैं. Your voice, your guide.
ये है रेडियो मानू 90.0 FM. चलो बात करके देखते हैं.
This is Radio MANUU 90.0 FM presenting Tu Hai To I'll Be Alright.
आदाब दोस्तों, तू है तो I'll Be Alright के आज के एपिसोड में मैं आरजे श्रद्धा आप सभी का तहे दिल से स्वागत करती हूँ. दोस्तों, आज के इस एपिसोड में हम बात करेंगे एक ऐसे हेल्थ इश्यू की जो है तो बहुत कॉमन, लेकिन बहुत सारे लोग इसके बारे में प्रॉपर इंफॉर्मेशन नहीं रखते. जी हाँ, आज हम बात करेंगे किडनी स्टोन्स के बारे में. और इस टॉपिक पे हमारे साथ हैं कंसल्टेंट यूरोलॉजिस्ट डॉक्टर ए साई किरण रेड्डी, हु इज़ एसोसिएटेड विद ओमेगा हॉस्पिटल्स गच्चीबौली हैदराबाद. इन्होंने बहुत सी नेशनल और इंटरनेशनल कॉन्फ्रेंसेस में शिरकत की है एंड ही हैज़ मैनी पब्लिकेशंस टू हिज क्रेडिट. डॉक्टर ए साई किरण रेड्डी, आपका हमारे स्टूडियो में हार्दिक स्वागत है.
Hi, thank you for the invitation and thank you for giving me this opportunity to speak about this most common topic, the renal stones, which nowadays it's the most common problem, which most patients will come to me in the OPD actually.
So that's totally our pleasure.
Yeah.
तो बिना वक्त जाया किए चलिए शुरू करते हैं.
Yeah.
So डॉक्टर साहब, what exactly are kidney stones? और ये हमारी बॉडी में बनते क्यों हैं?
See, if you tell what exactly are the renal stones, actually the renal stones are just the aggregation of all the minerals and the salts which are normally present in the urine. Okay, so to tell how exactly the renal stones are formed, it's simple as how we extract salt from the seawater. Okay, so normally the salt will present in seawater. When the seawater is dehydrated, the salt will crystallize. The same exactly. There are some normal minerals and the salts which we excrete from our body. Okay, as the amount of urine comes down, especially in case of dehydration, so these salts and crystals, minerals, will reach to a stage called supersaturation. They'll be concentrated in the urine, they'll reach to a stage called supersaturation. This is the first stage, supersaturation. So beyond the supersaturation state, these form small crystals within the urine. So this stage is called crystallization. So when these small crystals have been formed, they again aggregate together, small crystals, and they form one mineral structure, that what we call a stone, and this stage is called crystallization. Okay. So these are the normal 3 steps how the renal stones are formed within the body. So first stage is called supersaturation, next it will form crystallization, next it will form aggregation. So this is how the normal stones are formed in the body actually.
सो एक्चुअली डॉक्टर साहब, आपने बहुत इजी कर दिया हम लोगों के लिए, क्योंकि आपने जैसे बताया कि जिस तरह से ओशन का सॉल्ट जो है उससे पानी जब इवेपोरेट होता है, तो what is left is something which is crystallized.
Same thing, like when the dehydration occurs, the amount of water in the urine comes down. This will form crystals, and the crystals will aggregate to form the stones.
तो इसके कुछ टाइप्स होते हैं, कुछ कॉमन टाइप्स?
Actually depending upon the chemical composition of the stones, there are 4 to 5 different types of stones actually.
Okay.
The most common, up to from 75 to 85% of the stones, what we see are the calcium containing stones.
Okay.
So either it can be calcium oxalate or it can be calcium phosphate. Calcium phosphate. This is the most common type of stones what we regularly see. And the second most common type of stones is uric acid, which comprises around 10 to 15% of the stones. And the third most is the struide stone. Struide stone is generally forms in stones forms because of the infection. There will be some specific bacteria called urea splitting bacteria. When the urine becomes infected with that bacteria, this will aggregate to form the stones that we call as struide stones. Okay, because for the formation of this struide stone, infection with the specific type of urea splitting bacteria is mandatory actually. Okay, this is the third most common, and the rarely 1 to 2% will what we see is just cystine stones. Cystine stones are very rare, around 1 to 2, but yeah, we do see these type of stones are also in the regular practice actually.
Okay, so Dr. Reddy, as per my knowledge, हमारी बॉडी को सारे मिनरल्स की ज़रूरत होती है, बट बहुत ही छोटे अमाउंट में, बहुत ही कम अमाउंट में, माइक्रोग्राम्स में, I think.
I mean, it's all what I tell. It's in the balanced quantity what we require. Even the mineral, if it is less or even it is more also, it's like a double-edged sword.
So as you said कि एक टाइप ऑफ स्टोन जो है, आपने मुझे कैल्शियम से रिलेटेड भी बताया, ज़्यादातर ऐसा होता है कि एक एज के बाद लेडीज की बोन्स जो है वो कमज़ोर पड़ने लगती हैं और डॉक्टर्स उनको सजेस्ट करते हैं कि आप कैल्शियम की टैबलेट्स लीजिए। और कभी कभी ये भी देखा गया है कि लोग कहते हैं कि कैल्शियम ज़्यादा होने की वजह से उनको किडनी स्टोन्स हो गए, तो क्या बात सही है?
Yeah, if calcium is more, that is one of the risk factor for calcium forming stones actually.
Okay.
Hypercalcemia, there are people where we will see this in few people, even the calcium supplements are also will form the stones actually. But after the menopause, for the females to maintain the bone health, these calcium supplements are mandatory for them. So as I told, even the calcium, even if it is less, it causes a lot of problems. Even if it is more in the body, it causes a lot of problems. Even if it is more, this is one of the most common.
This is one of the most common issue that will happen.
Yeah, and even this calcium there are few endocrine diseases in the body. This usually the normal calcium in the body is controlled with a gland called parathyroid, which is just located just behind the thyroid. When there is an alteration, when there is abnormality in the gland, they produce more of the parathyroid, which will absorb more of the calcium from the body. So this is one of the most common endocrine causes of this calcium containing stones in the body.
All right, so back to topic. ये बताइए कि किडनी स्टोन्स के सिम्टम क्या हैं, मतलब आपको कैसे पता लगे कि आपको हो सकता है कि किडनी स्टोन है?
So as per, before the symptoms, I'll tell you, depending upon where the stone exactly in the genitourinary tract, we'll categorize into different types. One is the renal stone, if it forms within the kidney. If it forms in the ureter, that is the tube connecting kidney to the bladder, then we'll call it as ureteric stones. If it is within the bladder, urinary bladder, then we call it as a vesical stone. And if it is from the tube, from the bladder to outside, urethra, then we call it as a urethral stones. So depending upon where exactly the stone is there, the symptoms differ. But what we routinely see is the ureteric stones, which causes obstruction of the urine from the kidney, from the urine to come down. The most common symptoms which the patients come to us is the pain. The pain is actually the renal pain, that what we call as renal colics, is one of the most excruciating pain. Very severe pain. Like no one can tolerate that pain actually. This is one of the most severe types of pain which the human body can experience. So to tell exactly, this pain usually starts in one of the flank, and this pain peaks in about 1 hour, and it will radiate to the lower abdomen or to the genitals actually.
So I have a doubt, sir. The stones, they form in kidney only, right?
It's not mandatory actually. But most of the stones will form in the kidney.
And then they move down.
And they come down. And they come down to the ureter.
So isn't it good कि kidney में ही इतना दर्द होता है कि पता चल जाएगा हमको कि we have kidney stones?
The problem is the space within the kidney is very, compared to the urine tube, the space is more actually. So this pain will come when there is a blockage in the urine actually. So when the small stone within the kidney, it won't cause obstruction, proper obstruction of the urine flow from the kidney downwards. So most of the kidney stones will be asymptomatic actually.
Okay.
This will be diagnosed when we do scans for some other related issues actually. We do diagnose ureteric stones early because the space within the ureter is very less. Even a small 5 mm or 6 mm stone can cause the obstruction in the ureter and can cause the symptoms actually.
Okay. Are there any diseases like kind of risk factors? आजकल जैसे कहते हैं कि हाई ब्लड प्रेशर है या आपको डायबिटीज है,
actually,
तो किडनी फेलियर होने का आपको चांस होता है.
Okay.
लेकिन किडनी स्टोन्स का भी चांस होता है क्या, या आर देयर एनी अदर रिस्क फैक्टर्स जिसकी वजह से आपको किडनी स्टोन्स होने के?
To tell the most common risk factor what we routinely see is a dehydration. People not taking good amount of water.
Okay.
That's
Which
the
is
most
free.
common thing. So the intake of water, it all depends upon the amount of water what we are losing. Okay. So if you are ideally what we suggest is to take the water sufficient amount so that you can pass around 2 to 2.5 liters of urine. That is the ideal thing actually. So because few people will be working only in the ACs, so they might require little less amount of water. Few people will be working in the hot climatic conditions, so they might require more water because the most of the water will be evaporating from through like as the sweat or something. So they require little more quantity of water. Okay, this is the most common risk factor what we do. And nowadays the most common risk factors what we see is this what we call, most of the people now are in like full of health consciousness to lose weight and all. They're taking more of the high rich protein food.
Okay.
High protein food is one of the risk factor for the stone formation. Apart from that, high salt intake, not taking balanced food. Okay,
दोस्तों आई थिंक इस बात को आपको बहुत ध्यान से सुनना चाहिए कि वो जो प्रोटीन रिच डाइट हम लोग जिम जाने के बाद वेट लूज करने के लिए लेते हैं, दैट कैन आल्सो बी अ रीजन फॉर दिस इशू.
Formation. And even this, what I'll tell is the bariatric surgeries where the intestines, where part of the intestine will be resected actually. Even that is one of the risk factors for both the renal stones and the gallstones also.
So sir, इसके बारे में हम और बात करेंगे. अभी वक्त हो चला है एक ब्रेक का, कहीं जाइएगा नहीं.
आप सुन रहे हैं तू है तो I'll be alright, रेडियो मानू 90.0 FM का हेल्थ शो. This is Radio MANUU, a community radio station.
So join the wave, come along for the ride. Radio MANUU 90.0 FM, we're by your side. चलो बात करके देखते हैं.
Your voice, your guide.
This is Radio MANUU 90.0 FM. Let's listen to the Mindful Minute.
उपनिषद में कहा गया है, अंधेरे को कोसने से बेहतर है, अंधेरे को कोसने से बेहतर है कि एक दिया जलाया जाए.
Napoleon Hill shared a profound thought: whatever the mind of man can conceive and believe, it can achieve.
इंसानों से मोहब्बत करना ही दरअसल खुदा से मोहब्बत करना है, और इंसानों की खिदमत करना ही दरअसल खुदा की खिदमत है. अबू ज़र गफ़ारी.
ये है रेडियो मानू 90.0 FM. आप सुन रहे थे द माइंडफुल मिनट. For sales, marketing and brand promotions, write to us on Radio MANUU at manu.edu.in.
So join the wave, come along for the ride. Radio MANUU 90.0 FM, we're by your side. चलो बात करके देखते हैं.
Your voice, your guide.
तो I'll be alright. रेडियो मानू 90.0 FM का हेल्थ शो।
ब्रेक के बाद एक बार हम फिर हाजिर हैं। आज तू है तो I'll be alright में हम लोग बात कर रहे हैं किडनी स्टोन्स के बारे में। सर, आप मुझे बता रहे थे कि अगर कोई बहुत ज़्यादा स्कॉचिंग हीट में काम कर रहा है तो उनको ज़्यादा पानी पीने की ज़रूरत है। कोई एसी में है तो उनको
It all depends upon like how much urine you are producing. That's what I told. Na? Ideally, you have to produce around 2 liters of urine, like 1.5.
That's it.
That's it.
So even if you sweat a lot, then also you should drink a lot of water.
That is the most common things.
All right. सर, क्या मेथड्स हैं जिनसे आप डायग्नोज करते हैं किडनी स्टोन्स?
See, first of all, when a patient comes with the pain in the flank or thing, with the help of this history and the clinical examination only, we'll come to a conclusion that he might be having this because the pain of the renal stones is very specific.
Okay.
It will just form in the flanks. It is very severe. It's very like kind of colicky type of pain, and the radiation towards the lower abdominal genitals. With that, we'll just come to the basic idea that he might be having the renal stones, and his pain is because of the stones. So, what is the most common and the most cheapest and the most economical thing, and the fastest method? What we do is the bedside ultrasound.
What
ultrasound
is that?
scan. Ultrasound scan.
Ultrasound scan. Okay.
That is a basic thing. Where most of the times will be diagnosed, but the thing is the sensitivity of this ultrasound in diagnosing small stones. Sometimes even small stones can be missed with the ultrasound. Okay, so apart from the ultrasound, what we work up is next the kidney function test. How is the kidney function test? And is there any blood in the urine? Because when there is a stone in this, the most common thing what we see in the urine is some microscopic blood. RBCs will be passed in the blood. These are the basic things. So once, even if the ultrasound is inconclusive, the gold standard investigation is the CT-KUB.
Okay.
With the help of CT-KUB, we can diagnose even a smallest stone in the urinary tract. The sensitivity and specificity of the CT-KUB in diagnosing renal stones is like 95 to 98%. And with the help of the CT scan, we'll get the additional information also, like how hard is the stone. And now we got the newer CT machines where we can, with the help of some softwares, they can even tell what is the type of stones, whether it's a calcium oxalate stone, whether it's a uric acid stone. Depending upon that, our treatment modality changes actually. Treatment modality changes, and even the preventive measures for them to prevent the stones in the future, even those things will change.
All right.
So the CT is a gold standard actually, but what we routinely do is the ultrasound is a basic screening test, and then we'll go with the CT scan.
All right. सर, इसमें कोई एज फैक्टर भी इन्वॉल्व होता है क्या कि इस एज तक के लोग कम रिस्क में आते हैं और इस एज से इस एज तक ज़्यादा रिस्क?
So actually the most commonly what we see in the like nowadays teenagers and the adults, now even we are seeing in like even the very young people also, we have seen there is a documentation where the stones are formed in 6 months to 9 months baby also.
Oh my
These are all because of genetic disorders.
Okay.
Because of some other inherited disorders where there will be like calcium hemostasis, uric acid hemostasis will be altered because of the genetic things, and these stones are formed. So these are
hereditary also plays a role in this?
Hereditary also definitely. There are few hereditary disorders in the body. Those are like categorized as high stone formers, high risk of stone formers. They are kept on frequent follow-up actually, so that we can identify the stones in small size and we can just do the treatment actually. There is a separate group of diseases where we termed as high risk stone formers.
Okay. So I mean, once they are removed again, it will form.
Yeah, I'll tell you one more thing because you asked this. Once a stone former is always a stone former. If a person is if a person forms stones, the chances of him forming stones in the future compared to normal people is 50 times more percentage than compared to other person.
But sir, there must be some lifestyle change that they can follow and they can
actually
avoid.
Nowadays we are focusing more on the prevention of the stones. Once the stone has formed for a person, once we do the surgical removal and all, so our focus will be more on the prevention in the future of the same person instead of treating the stones when it's formed.
Exactly.
So now we have a lot of things, like a lot of this advances in the medicine actually, where we can, once the stone has been removed, we'll send a small piece. What we routinely practice is we'll send a small piece of stone to the chemical analysis.
to the chemical analysis.
So that we will find out what type of stone is it, whether it's a calcium oxalate stones, whether it's the uric acid stones, steroid stones, or cystine stones. So depending upon that, what exactly is the chemical composition, there are few dietary habits and a few medications where we can prevent the stones in future. We'll target those things. So let's say if it's a uric acid stones, what a person is having, we have got to know that the patient is having uric acid stones. So we'll be keep on regular monitoring the patient's uric acid levels. And we'll advise the patient to avoid some food which has high uric acid contents. Like this, there are few, and we have even few targeted medications to decrease the uric acid levels in the body also. So we'll keep the patient on that so that it will help in the prevention of stones in the future.
So it is much like diabetes. You will always have to check.
Yeah, obviously.
You will always have to follow up with the doctor.
Every 6 months or 1 year, you have to undergo periodic ultrasounds actually. Now, even the ultrasound abdomen has become a part of this health checkup, what we yearly do.
Also, sir, once it is diagnosed that, you have kidney stones, then how do you decide whether you will go for non-invasive or invasive method of treating it?
So once we diagnose the stones, so we'll see where exactly the stone is. Whether it's inside the kidney, whether inside the ureter, or inside the bladder or all. And how is the condition of the patient. Okay, so one of the most common indications when we go for, like what decide that we go for surgical management is, patient is having severe pain. In spite of in spite of so many painkillers, pain is not getting control. That is the most common indication what we go for surgery. And second thing what we see is the infection. Because of this blockage of the urine with the stone, because the stasis of urine is in the body, the chance of infection is there. Once the urine gets infected, once there is an infection because of the stone, it has to be intervened immediately. Otherwise there is a chance of the patient deteriorating very fast. And third thing is the kidney function test. If the serum creatinine is the functioning of the kidney, what we see by the biochemical parameters is the creatinine. If the creatinine is raising continuously, so that is one of the indication. And the other things are if the stone is more than 15 mm, 1.5 centimeters within the kidney, which is very unlikely to pass down. So that has to be intervened surgically. And for the few patients, I told one of the symptoms it can be blood in the urine. So if the patient is having continuous blood in the urine, so that is also one of the indications for stone. And there are few set of people who work in certain climatic conditions. People who are like traveling very often, like they'll be traveling very often, like especially if they're soldiers, they'll be working in the border areas and all. If we diagnose them, even a 7 mm stone in the ureter, what we advise them, because the medical facilities are not that good. It's not that good because they're not accessible to medical management. So this can flare up anytime. So we'll tell them to get it operated. So especially this army people and all, like people who work in extreme these things and all, and people who are traveling very often. So those people, and there are few patients with multiple comorbids and all. So for them people, if there is like simple thing, we'll just tell them to remove it. Instead of going it for emergency procedure, when the creatinine is gone up, when the infection settles in, then that become emergency surgery. So instead of them, I'll tell them when they are stable condition to get rid of the stones. Because already because anytime elective cases, the results are much good than compared to emergency cases.
Right. So basically, Dr. Reddy, आपने सब कुछ जो बताया, I think we should take a break. और आने के बाद हम थोड़ा सा लाइफस्टाइल चेंजेस क्या होने चाहिए उस पर बात करेंगे. तो कहीं जाइएगा नहीं, सुनते रहिए रेडियो मानू 90.0 FM.
You are listening to Tu Hai To I'll Be Alright, Radio MANUU 90.0 FM's Health Show. ये है रेडियो मानू, एक कम्युनिटी रेडियो स्टेशन.
So join the wave, come along for the ride. Radio MANUU 90.0 FM, we're by your side. चलो बात करके देखते हैं.
Your voice, your guide.
किया है।
आदाब, मैं हूं डॉक्टर हशमत और आप सुन रहे हैं अर्ज किया है। अर्ज किया है में आज तस्करा होगा मखदूम मोहिउद्दीन का। दिलों में इज्तिहा में आरजू लब बंद रहते थे, नज़र से गुफ्तगू होती थी, दम उल्फत का भरते थे, ना माथे पर शिकन होती, ना जब तेवर बदलते थे, खुदा भी मुस्कुरा देता था जब हम प्यार करते थे। नाम अबू सईद मोहम्मद मखदूम मोहिउद्दीन कुदरी 4 फरवरी 1908 को संगारेड्डी तालुका आंदोल ज़िला मेदक हैदराबाद दक्कन में पैदा हुए। वो एक मजहबी घराने के चश्म चराग थे। इब्तिदाई तालीम घर पर हासिल की। 1934 में जामे उस्मानिया से BA और 1936 में MA की डिग्री हासिल की। 1936 में सिटी कॉलेज के शोबे उर्दू से वाबस्ता हुए। 1941 में चंद वजूहात की बिना पर मुस्तफ़ी हो गए। 1940 में मखदूम कम्युनिस्ट पार्टी के सेक्रेटरी मुंतखब हुए। जुलाई 1943 में अंजुमन तरक्की पसंद मुसन्निफीन की बाकायदा तश्कील मखदूम की रहनुमाई में अमल में आई। 1956 में आम इंतखाबात के मौके पर वो आंध्र प्रदेश असेंबली के रुकन मुंतखब हुए। अपनी वफ़ात तक वो उसके रुकन रहे। उन्होंने पाबंद और आज़ाद नज़में भी लिखीं। क़िताअत, रुबाई और गज़लों में भी तबा आज़माई की। सुर्ख सवेरा, गुलेतर, बिसाते रक़्स उनके शेरी मजमूए हैं। फिर छिड़ी रात बात फूलों की, रात है या बारात फूलों की। मखदूम की शायरी जालिम और साम्राज्य क़ुव्वतों के ख़िलाफ़ मज़लूम और दबे कुचले लोगों की दिल की आवाज़ है। हयात ले के चलो, कायनात ले के चलो, चलो तो सारे ज़माने को साथ ले के चलो। 1969 में उन्हें साहित्य अकादमी अवार्ड से नवाजा गया। ज़िंदगी के आखिरी अय्याम में मखदूम को सीने और हलक की तकलीफ़ थी। वो 25 अगस्त 1969 को दिल्ली में इंतकाल कर गए। आपकी याद आती रही रात भर, चश्मे नम मुस्कुराती रही रात भर। दोस्तों, ये थे मखदूम मोहिउद्दीन और उनके हालात ज़िंदगी। कल होगी आपसे दोबारा मुलाकात। इस उम्मीद के साथ इजाज़त दीजिए। आदाब।
आप सुन रहे थे अर्ज किया है। सेल्स, मार्केटिंग और ब्रांड प्रमोशंस के लिए हमसे राब्ता करें radiomanu@manu.edu.in पर।
So join the wave, come along for the ride. Radio MANUU 90.0 FM, we're by your side. चलो बात करके देखते हैं।
Your voice, your guide.
Listening to तू है तो I'll be alright. Radio MANUU 90.0 FM's Health Show.
तो दोस्तों, आपका फिर से स्वागत है। ब्रेक पर जाने से पहले माहौल काफ़ी सीरियस हो गया था, इसीलिए अब मैं थोड़ा सा लाइफस्टाइल चेंजेस के बारे में डॉक्टर साहब से बात करना चाहूँगी। सर, ये बताइए कि प्रिवेंशन इज़ ऑलवेज बेटर देन क्योर। So how can one prevent development of kidney stones in the body?
Okay, I'll tell you the basic things what a person can do just to prevent the renal stones. The first thing what I'll speak about is the fluid management.
Okay.
So ideally, every person should take around 2 to 2.5 liters of water per day.
Only water. Some people go for juices. Fluids. Okay.
Out of this, ideal fluid is the water.
Is the water.
That is how it is, and as I told previously, a person should normally urinate around 2 to 2.5 liters per day. That is how the normal urine he will maintain the concentration of the minerals so that it will flush out from the body.
So if you say that 2 to 2.5 liters urine should be it should be urinated, then how much water should be taken?
So around 3 liters you have to take.
Around 3 liters, not more than that?
Yeah, I mean, see, water is again, intake of water is again a double-edged sword, what I told.
Okay.
Taking less amount of water is is always lead to a lot of things. Even taking more amount of water will also takes will also causes a lot of problems in the body.
Is there any formula how to decide upon as per your weight or something?
There's nothing actually. I mean, those are very complicated things. Ideally, you have to take around 3 liters of water at regular intervals. It's not like regular intervals. It's not about drinking 1.5 liter in the morning continuously, 1.5 liter in the night. So you have to take regular intake of water. And ideally preferred fluid, what we get very cheap is the water. That is how the fluid intake should be. And coming to speak about the diet, so always person should have a balanced diet, so that meal should contain adequate amount of calories, carbohydrates, proteins and fats. That is what we call as balanced diet. And try to limit the animal protein intake. And try to limit the sodium, like sodium chloride, that is salt intake. And try to avoid sodas, that's carbonated water, like Thumbs Up, Coke,
cold beverages.
Which contains this carbonated water. And the limit alcohol. All the alcohol will, the excess consumption of alcohol again will cause us the stone formation.
So it damages not just liver but also kidney.
Everything.
Okay.
These are the few things about the diet. And regarding the lifestyle changes, regular exercise, just maintain your body BMI, because obesity is one of the risk factors for stone formation.
I think for all types of diseases.
So this is one of the things. And the most important thing is you have to balance your excessive fluid loss from the body. It's like if you're sweating more, drink like little more water. These are the few lifestyle things which are in our hands, which we can do it to prevent the stones formation actually.
And some people also like to go for alternative medicines.
Regarding this alternative medicine, see, in the acute pain and all, I don't think this is of much helpful. If patient comes with severe pain and all, most people will go for alternative medicines just if there are asymptomatic stones. Like patient is just incidentally detected, like if you are doing scan for some other reason, incidentally he has found that there is a small renal stone. So these people will take these alternative medicines, but the results I'm not that sure. The few people believe that it will help in stone formation, and the few people will come and tell I've taken these medicines and my stones got melted and all. Which usually stones getting melted is one of the rarest thing what we see. Usually it has to pass out from the body. Melting of the stones will rarely happen actually.
But is it okay or is it really very...
It all depends upon the patient's belief actually, obviously. So if the patient is believing that, he will take. It's not that we should not it's like we doctors won't pressurize the patient to take any medication. What we do is we tell the best what he can do. It all depends upon the patient what he has to take for his health actually.
So what are the potential complications, Dr. Reddy, if it remains untreated?
One of the most common things what we acutely see is the infection. If once the infection settles in the obstructed system, it will flare up very fast in the body. As it goes, patient might go into sepsis also. Sepsis is like the final stage of the infection in the body. So that is the most dreadful complication what we see. So
what happens in that sepsis?
Sepsis is like the infection will spread in the almost entire body. The kidneys will start deteriorating. Almost all the organs will start deteriorating. This is the most dreaded complication, which will form in the which we see in the acute setting. If we see chronically, if the stone is there where we have been diagnosed, so we person has gone to the doctor and he has taken some medication. After some time the pain has subsided. So he don't know whether the stone has gone or not from his body. So because what a patient thinks, because the pain is not there, he might think the stone has gone. But these things chronically, this pressure, the pressure on the kidney will be increasing because of the stasis, and over a time actually within 6 months to 1 year and all, the kidney will stop functioning. So we have seen the patients who has come with a non-functioning kidney.
Oh my God.
After 1 year. When we ask him, he will tell, 1 year back I have a stone, but I have taken medication. That time it was cured. But that time it was not cured. Only his pain got subsided. His body got used to the stone, and slowly the pressure on the kidneys will got increases. As the pressure increases, the functioning parenchyma of the kidney got thinned out, and the kidney will stop functioning.
So it got damaged.
It got damaged completely. Like there is no functioning of the kidney, and we have even removed the kidneys also. Like chronic stone obstruction, where the patient is neglected actually. So there are instances that is the final stage actually. The kidney will stop functioning. We may have to remove the kidney also that time.
So can you break some myths about these kidney stones?
Yeah, there are actually two, three things where the most of the people will ask actually, especially males. Like people will come, I'll tell, drink a lot of water, the chances of flushing out from the small stones in the body is high. Most of them will ask, I'll have the alcohol, like beer, so that I can pee more. Like beer is a natural diuretic actually. So, but drinking alcohol will cause stones actually.
Yes.
That's the most common things where the people will ask. So can I have beer so that I can pass more urine so that it will flush out?
They just find an excuse to drink.
So this is one thing. And a few people will come. Like one person has come. He has one small stone. So I've operated and he got rid of the stones. After 2 years, again he'll come with one more stone actually. So people will come and ask, like last time we have removed the entire stone. How come this stone has formed now? Because you have left some stone in the body. So because he don't understand this, once he is a stone former, as I told, is always a stone former. So it's very difficult for us to convince that stone has gone. This you have formed the new stone over a period of 2 years. These are a few things where people won't understand what we regularly tell actually. It's very difficult for a person to understand that stone has gone. You have developed the new stone and all. Most of the things he won't accept most of the times.
So actually regular follow-up is very, very important.
Yeah,
once you have developed kidney stones, regularly go to the doctor. So how it should be gapped? I mean 6 months, 1 year?
See, I'll tell you. We'll categorize. There are few high-risk stone formers actually. There are few disorders in the body, like I told, hyperparathyroidism. There are some metabolic, there are some structural changes in the kidney there where few salts won't be get reabsorbed from the kidney, so the concentration of those salts in the urine will be very high. So in those, if you find any abnormality or anything and all, we'll just keep him on regular follow-up. If it is uric acid stones, we'll just tell him to check the uric acid levels very often, every 3 months, and use the medication for that. So yeah, this is, and ultrasound after the stone we are removed, we'll tell them to get an ultrasound after 6 months and after 1 year. If there are no stones, we'll tell him to repeat the ultrasound every yearly as a part of his general health checkup. So yeah, these are the few things where the patient should be on all, like once after a stone has been cured, he has to be on follow-up regularly.
Okay. So दोस्तों, आज हमने किडनी स्टोन्स के बारे में बहुत सारी जानकारी हासिल की और हमारे साथ थे इस टॉपिक के लिए डॉक्टर ए साई किरण रेड्डी, जिन्होंने हमें बहुत ही इंसाइटफुल इन्फॉर्मेशन हमारे साथ शेयर की। डेफिनेटली किडनी स्टोन्स का ट्रीटमेंट ज़रूरी है, लेकिन उससे भी ज़्यादा ज़रूरी है प्रिवेंशन, और लाइफस्टाइल चेंजेस से ये मुमकिन है। अगर आज का ये एपिसोड आपको पसंद आया हो तो हमारे इस प्रोग्राम को फॉलो ज़रूर करें और अपने दोस्तों के साथ शेयर करें। अगली एपिसोड में आपसे फिर मुलाकात होगी। तब तक के लिए अपना ख्याल रखिए और सुनते रहिए रेडियो मानू 90.0 FM। चलो बात करके देखते हैं।
आप सुन रहे थे तू है तो I'll be alright, रेडियो मानू 90.0 FM पर। चलो बात करके देखते हैं।
This is Radio MANUU 90.0 FM. चलो बात करके देखते हैं।